So the long-term outcomes for patients who were treated with either Nivolumab or Nivolumab combined with Ipilimumab in patients who had active melanoma brain metastasis. This is called the ABC trial, or the anti-PD-1 brain collaboration trial. So in that trial there were 3 cohorts, but I'm really only going to discuss the 2 randomized cohorts. So patients with asymptomatic untreated brain metastases were randomized to 2 arms. The first arm, I'll refer to as cohort A, received combination immune therapy with Nivolumab combined with Ipilimumab, and cohort B were patients who were randomized to Nivolumab monotherapy. So these patients did very differently. Those who received the combination immunotherapy had a very high intracranial response rate of 51%. And if we excluded patients who had had a prior BRAF or MEK inhibitor, these patients had an intracranial response rate of 59%, so much higher when they came to the trial drug treatment naive and with no prior local treatment. For Nivolumab alone, however, the response rate was much lower. It was 21%, and if we exclude, 20%, and if we excluded the BRAF and MEK inhibitors, it was 21%. So first answer that this trial answers, or the first question this trial answers is Nivolumab combined with Ipilimumab more active in the brain than Nivolumab alone? Well, certainly it induces a much higher response rate. Then when we look at the intracranial progression-free survival, for the cohort A combination therapy, the 3-year, so this is a long term, the 3-year intracranial progression-free survival was 43% for all of the patients. However, again, if we exclude those who'd had BRAF and MEK inhibitors, it was 49%. So that's nearly half the patients with brain metastases not progressing for 3 years. Normally, these sorts of patients would survive 16 weeks. So this was a huge improvement. In terms of Nivolumab monotherapy, the other cohort, the intracranial progression-free survival at 3 years was 15%. And if we removed the BRAF MEK inhibitor previously treated patients, it didn't make much of a difference. It was a 14%. So again, Ipilimumab combined with Nivolumab appears to be a lot more active in the brain, inducing a higher response rate and more durable responses.